certainly North Dakota and Minnesota, northern Minnesota in particular, have always been underserved for primary care. As such, we've incorporated APCs, as we call nurse practitioners and physician assistants, into our practices for a long time. About 2 years ago, Michelle Edwards, who's the National Director for Nurse Practice in CHI, nurse practitioners and APCs, as we call them, talked about a program to increase the number of APCs or nurse practitioners associated with a physician. In Williston, where we have rapid growth in our population due to the oil boom, we have 2 internists and we need 17. And we have, at that time, no APCs, no PAs or NPs working with them. So they were by themselves. And they were trying to take care of all these people when they needed 8 times as many as themselves. People that were really, really sick couldn't get in to see their doctor. I mean, it just takes forever. So we started about 2 years ago looking at the model. And we said, well, if we put 3 nurse practitioners or PAs with each one of these internists, now we've got 6. Well, Williston, North Dakota is a cold, isolated place. In the winter, it gets really cold there. But it's an exciting place because of the oil boom. It's hard to recruit people there, and when they come, it's hard to keep them because the oil companies all hire them away from you. So we tried to recruit, and we were unable to recruit nurse practitioners or internal medicine doctors. We had a couple. We had one nurse practitioner who was working in family practice alone, and she decided to become part of the collaborative model with one of our internists, and that was the beginning. Realizing that we weren't unable to recruit, we decided to grow our own. Now we started a program about 3 years ago now. We started thinking about it with the University of Mary in Bismarck, North Dakota, where we funded 13 of our nurses in our small hospitals throughout North Dakota, Minnesota, to go through the nurse practitioner training program at the University of Mary. And in exchange, they need to come back to our facilities. And Williston is going to have 2 of those folks coming back to join them in the spring, which is our first graduating class. So we're really pleased by that. So that's our long-term strategy of sustainability. We've got a regular pipeline now of nurse practitioners that are trained and coming into our rural facilities. We co-located the physician and the nurse practitioner next to each other. And initially they started their practices just like they'd always been doing, one doing my own, another one doing my own. They'd always had a relationship. And now they're starting to merge their practice, where the nurse practitioner starts to take over some of the regular patients from the internist as they've gained trust and understanding of the model and in each other's abilities. They're gradually integrating their practices. We had to go forward with the interviewing and seeking of additional practitioners because model is 3-on-1. It's not 1-on-1. And it's hard to recruit people. And so we're waiting for the next 2 to join us in the spring. And that's where we're at. Well, I think that the first thing is to involve the people that are going to actually be doing it right away, because they're going to change it the way they need to do it. They're going to figure out the nuances that you can never imagine from an academic perspective. The second thing is don't give up. This is hard work, changing a whole culture that goes back generations. Just keep working at it. That's a very important piece. Third one is think long term. This doesn't change instantly. We're changing the whole way that we take care of patients and the whole way we think about how we take care of patients. Everything from how do you register patients, how do you room patients, who sees the patients, how do you get paid for the patients, how do you pay the team, how do you measure the team. All of that has to change. I would say the biggest and most important thing is have a plan, know where you're going, and go there carefully, thoughtfully, and with steadfast determination that you'll get to the end, because you will.